Assalamu alaikum wa rahmatullahi wa barakatuh, Dr. Haffejee, and welcome to Phenomenal Woman. And you are indeed a phenomenal man.
Wa alaikum salam wa rahmatullahi wa barakatuh, Baby Aisha, and also to your esteemed listeners.
It's a pleasure having you here, doctor. And you know, when it's a doctor, it's like a 24/7 doctor on call all the time. Am I right?
Yes, all the time. Yeah, even if you're on holiday, people ask you what's wrong with them and what
and
to do.
I'm sure when people meet you, they probably meet you at maybe any of maybe at the beach, or if they see you somewhere and like, doctor, I just needed to ask you, and you're back on call, right?
Yes, absolutely. And it becomes automatic after a while to all doctors. It's not only me, it's everyone. It just becomes automatic that we try to help people,
Alhamdulillah, may Allah subhanahu wa ta'ala reward you and everybody in the medical profession for the outstanding work that all of you do in educating, empowering, and assisting people wherever you go. May Allah continue to bless you with the knowledge where, you can offer like support and assistance to everybody. So, doctor, I just need to let you know that today you're in my hot seat here in the studio.
Yes.
And the questions are going to come in and we're going to take full advantage of your expertise today, inshallah. May Allah subhanahu wa ta'ala accept our efforts. Ameen. A'udhu billahi minash shaitanir rajeem. Bismillahir rahmanir rahim. My beloved listeners, if you would like to send us your WhatsApp, you can do so, inshallah. And Dr. Haffejee will happily answer any of the questions that you have related to basic first aid during the holiday period. So, Dr. Haffejee, the first thing I'm going to ask you, and I'm a bit naughty, I must admit, I'm very, very guilty of this. Sunblock, sunscreen, choosing the right SPF. I'm very lazy to wear sunblock and sunscreen. And then I have all these pink burn sort of marks on my cheeks and my nose. And I'm sure many people like me sometimes can be a little bit lazy to put on sunblock. What is your advice to us?
This the sun in KZN especially.
Yes.
And all over South Africa actually it has a very high it has a very high burning effect on the skin. UVA, UVB, very high concentration.
Yes.
So the lower you are near the coast, especially near the beach, you don't only get the sun from the sky, but you'll get the sun from the reflection of the water. And in fact, if you are near the sea where there are waves, the bigger the waves, the bigger the reflection from the waves onto you. So you're going to get a double effect from the sun above you and from the sun from the water. So that's why people burn more at the beach than they burn away from the beach.
I didn't know that. And just before you continue, I'm just, another thought that just crossed my mind right now. Sometimes the day could be overcast, right? Ted, there's like this gray sky, it's cloudy, but it's still hot. So you go to the beach and you're still burning.
Yes.
And then you'd wonder, okay, how did that happen?
It depends on the thickness of the cloud. And you need to look at the weather forecast and see what the UV rating is.
Yes.
And if it's high, even if it's overcast, it can be high. You still burn.
Yes.
So it's always a good idea to use sunblock. And if you're a person who forgets to put sunblock, and so you need to wear a wide-rimmed hat and cover yourself up, so that even if you use sunglasses, because this bright sun can be quite damaging to the eye as well.
Yes.
It damages the white of the eye, causing like a scarring. It's called a pterygium. It causes scarring of the white of the eye, and sometimes it becomes quite thick and it needs to be removed. It's like a scar tissue on the eye. So sunglasses also we forget about that. We think about our skin and not worry too much about our eyes. But yes, it does affect the eyes as well.
But now, obviously, we're talking about now good quality sunglasses, good quality sunblock, obviously.
Yes.
It's not those, cheap 10, 20, 30 rand ones. You're obviously thinking of something that's going to protect your eyes.
Yeah.
So what would be the recommended sort of, I'm not saying brand names, but generally they have a certain magnification,
SPF.
Yes, for the sunblocks. But even with the sunglasses, must it be like the darker tinted lenses, or what is your recommendation?
Yeah, some of the cheaper sunglasses, they don't protect your eyes because they're just tinted.
Yes.
They're tinted. They still allow the UV rays to come in. So you need to like a Polaroid type sunglasses,
strong.
especially if you've got sensitive eyes.
Yes.
So you need to do that. You need to make sure that you protect your eyes with a good. But we have another problem because we are Muslims. We cover ourselves, and the only part that's exposed is our hands and our face, and we need the sun to get the vitamin D.
Yes.
So if you put sunblock on our face and our hands, and we're not getting the vitamin D conversion that takes place in the skin.
Yes.
So you need to plan and expose yourself at home in a private situation to get that vitamin D. You don't have to do it for long.
Yes.
15-20 minutes. Back of your body, back of your is the best place to get that vitamin D.
And the best time to be enjoying that sun?
Well, you any time of the day, as long as it's not for too long.
Yes.
Yeah, but now coming to the
sunblocks.
There's a sunblock. They found that above 50, there's not much more benefit.
Oh. Okay.
So the highest you can go to is 50. After that, you're just wasting money buying something more expensive.
Yes.
So 25 will protect you, 30 will protect you, but 50 will protect you very well.
Very well. Yes.
And above that, you don't have to buy anything above that because, and then sometimes the marketing will tell you 90%, cover,
Yes.
But it's not, the benefit is very little from 50 to 90. So 50% is fine.
It's quite good enough.
SPF 50.
Yes.
Fine.
Yes. And then obviously when you're going into the water, coming back, because I know there's so many variations now. There's water resistant and all of those other non-greasy, and it's all fancy, but it's very important. And this is not just for December or going to the beach. This should be something that we should be doing every day because we know our South African summers can be pretty harsh. So I think doctor's orders sunblock almost every day.
Yes, you should put it on every day when you're going out in the sun.
Yes.
But for the vitamin D, you don't have to do it every day. 2 or 3 times a week, expose your back to the sun in your private place in your home at a time when it's convenient for you. But you should put sunblock every day.
Yes.
And some people have sensitive skins.
Yes.
Some people have conditions like lupus, SLE, where the skin becomes very sensitive, and those people really, really need to keep out of the sun. Completely out of the sun. You must be in the shade all the time because their skin really becomes very inflamed.
What about certain people that they may get, like a rash? Maybe, like say they're out in the sun for some time, and they would get just maybe a rash, maybe only on their arms or maybe only on their neck and back. So it's not the entire body; it's just that little part. What would cause that? Because that would be like something I would always wonder. As a former teacher, I used to see that sometimes with some of the children. So just maybe the arms or just maybe the legs. Why is that?
Yes, our skin is very very sensitive. It's a very sensitive organ, and it can react to various things. And even wool, woolen garment on the skin can irritate the skin, causing a rash.
Yes.
So these things come and go. And if it's localized, it may be bites. It may be bites that's affecting that part of the body, or it may be some irritation. If you scratch your skin too much, it'll go red and it'll become inflamed and it'll start itching.
Yes.
So that also can cause a problem.
Yes. Now, Dr. Haffejee, when it comes to summer, we all know, when it comes to the beach, there is blue bottles, there could be jellyfish. We all know bees. Bees follow us everywhere, especially in summer when we got all these nice sweet things. So between the three, how is it best recommended to treat it? Even for us as adults and even for children that are listening in today.
The first thing to do is to look at the weather conditions.
Yes.
Right? And you'll find that the jellyfish and the blue bottles will come to shore when the wind is blowing towards the shore, from the sea to the shore.
Oh.
And you'll find them coming over to the shore.
Yes.
So if the wind is blowing from the land to the sea, you won't get blue bottles and jellyfish. So you just have a look to see when you get to the beach which way the wind is blowing, and that'll tell you. The wind is blowing towards you from the sea, then there is a possibility that you're going to get blue bottles and jellyfish. Then what you do is you walk along the shore, on the shore, and you'll see the blue bottles on the ground.
Yes.
And if you see the blue bottles, now you know the blue bottles are in the sea.
Yes.
And when they are in the water, you cannot see them.
Yes.
You can't see them. You don't know where they are.
Yes.
Now, again, it's not the blue bottle itself. It's actually the tail of the blue bottle that has the cells in it that protect it from predators.
Yes.
And That's what wraps around our legs and our torsos and
Yes.
creates a problem. But if if you see blue bottles, don't even touch them. If you see
Yes.
jellyfish, don't even touch it,
Yes.
because once you get the cells of these the blue
Yes,
bottles and the
yes.
jellyfish, you can get a reaction on your fingers wherever you touch.
Now, if for whatever reason somebody does get stung by a blue bottle or
Yes.
jellyfish, basic first aid, what to do, what not to do. I know
Well,
you're going to say don't panic.
yes. The first thing to do is to wash the area, but use salt water. You have to use salt
The
water.
seawater?
You seawater, yeah. You
Okay.
don't use somebody's drinking water from a bottle.
Oh,
Don't use that water, because if you use that water, you're going to break up more of the cells, causing more of the toxin to be released,
sure.
creating more of a problem.
Yes.
Right?
Yes.
So because it's osmosis, it's to do with osmosis.
Yes. Yes.
The cells of the jellyfish
Multiply.
have got salt inside,
Yes.
and the salt water has got salt outside. So there's an equilibrium. Now you put normal water outside and salt water inside. The salt water inside the cell pulls the water inside the cell. The cell explodes, releasing
more
the poison.
Of the poison.
Yeah.
That is so important to know. That we didn't know that. That is amazing. And so
you wash it with salt water.
Okay.
Go to the edge of the water and wash it with salt. Make sure you don't get stung again by another.
Yes, no,
by
most
another
definitely.
blue bottle, right? And then what you do is if you see the toxin is neutralized by heat.
Yes.
So in the beach, you're not gonna. It's difficult to get something hot.
Yes.
But if you've got a flask of something hot, that's what you put on it. If you put hot stuff on it, it neutralizes the.
So like warm water.
Yes, hot water. Hot water. But
like
sometimes you can't.
Have some hot water when you're at the beach if
Yeah.
it's so hot. So yeah, you probably ran to someone close by that's selling something warm.
Yeah. The other thing that neutralizes it is vinegar.
Yes.
And I see in Durban, on the Durban beachfront, they use methylated spirits.
Okay.
That also neutralizes it.
So you just dab a little bit on with a bit of cotton wool and just leave it to basically kill the toxin.
And within an hour is better. In fact, less than an hour, it'll be all gone. But if you get a lot of stings, then it can last for a longer time. And there you need some cortisone cream.
Immediate
put some
from the doctor.
after you washed it with salt water, with the seawater, and you you can put some vinegar on it, or you can put some methylated spirits on it. And if it's still burning and it's still red, now you need some
medical assistance. So go to the lifeguard, get some help.
Yes.
Okay. Dr. Haffejee with us today here on Phenomenal Woman, this phenomenal man, alhamdulillah, sharing some very beneficial advice on how to perform basic first aid on a holiday. So there's many more questions, my beloved listeners, that I will be posing to Dr. Haffejee. You are welcome to send us your questions as well. We are going to be going into an ad break, my beloved listeners. Please don't go away. Dr. Haffejee, what is your guidance to listeners that sometimes want to do that? I know I've been guilty of doing that many times when I know I can't manage, but I don't want to also be the spoil sport.
Yes, that's a big problem. People get enthusiastic when they go on holiday, and they feel elated, and they want to do things that the youngsters are doing. And of course, youngsters may be playing soccer, and the 20, 25-year-olds are running around, and you think when you were 20, 25, you were also running around, and now you want to show the 20, 25-year-olds how good you are. In the meantime, you've been sitting in an office all year round, and your muscles are all lost or tone, and you got no strength, and you want to go and perform like how you performed when you were 20, 25 years old. That's when injuries occur. That's when muscles get strained and ligaments get torn and tendons get torn and all kinds of problems arise.
So the best advice: train before you go on a holiday.
No, I think you should just accept the fact that you are not as young as them, and so perhaps you can take part in the soccer, but be a goalkeeper.
Yeah, that also requires strength. But it's good to know that. It is
Yes.
good to know because you don't want to also push your limits.
No.
And sometimes also, I mean, if you're doing activities as a family, I would think, choose something that everyone can participate in as well.
Yes.
I mean, you could get the 20-year-olds also. They could be pretty unfit. Let's be
Yes.
honest, not just us that are, over 45
Yes.
that may be, sitting on the couches all the time and now
Yes.
they're the ones that are tired.
Yes.
But what would be your basic first aid when it comes to soothing those sore, tired
Yes.
muscles? Because the next day
Yes.
you're still on holiday,
Yeah.
but you're sore.
As far as hiking is concerned, I think the people, you get enthusiastic. Everybody wants to do. They look at the trail. Don't pick the hard ones. Leave the hard ones for the professionals.
Yeah.
You try and get the light ones, the easy ones, because you're on holiday. You want to take things easy. You don't want to create a problem for yourself.
Yes.
So whoever is organizing it should look for the easiest trail that you can find.
Yes.
So at least you went on the trail, and you can tell people I've been hiking, but they don't know how easy it was.
Exactly.
But so that's the first thing to do. That's to prevent the injury. But if you come back with injuries, and of course remember, if you go to the berg, there are snakes around there too, so you have to be careful because there are snakes in
we need
some
to be
very
careful.
venomous snakes in the Drakensberg.
Yes.
So you have
and
to
in
be
various
careful
areas.
about that too.
You need to be mindful.
So, yes, your footwear is important.
Yes,
you have to wear
absolutely.
good footwear to do that, and maybe a hiking stick if you're going to climb.
Be doing
places,
things like that.
So if you do get injured,
Yes.
remember it's a muscle injury.
Yes.
The first thing that you do with any muscle injury or ligament or tendon injury is to cool it, because if you cool it, you decrease the inflammation immediately.
Oh.
So and cooling it not for 5 minutes. You cool it for a good hour.
Yes.
Half an hour,
Yes.
2 hours, sometimes 3 hours. You have to keep cooling it. Keep cooling it.
Compression there all the time.
Absolutely.
Yes.
And that's the thing to do. And that's the best way to try and get that inflammation to stop. So that it doesn't get worse, so that you don't have to have more treatment for it.
No, most definitely.
Yes.
Dr. Haffejee, I think we're going to be going into an ad break now. When we return, we're going to be talking about motion sickness, whether it's seasickness, whether you're in the car and you're not feeling good, whether you got a crying baby before you're going to the plane, what to do, and many more questions coming your way. Assalamu alaikum wa rahmatullahi wa barakatuh, my beloved listeners. Yes, you are listening to me, Bibi Aisha Lahi. But today you are also listening to a phenomenal gentleman, Dr. Farouk Haffejee. Alhamdulillah, we are talking about basic first aid during the holiday time. And Dr. Haffejee, when it comes to motion sickness, now it could be like 3 scenarios. So let's first start with, if a family decides they want to go on a holiday and they decide they're choosing to go on a cruise, so seasickness. Or you could also go on one of these boats or ferries, and go out into the sea and see what that feeling is like. And then later you realize this wasn't a good idea. What is the basic first aid that is strongly recommended when somebody's feeling that sense of bilious or nauseous and they're just feeling really, really bad?
I think the first thing to do is to recognize that is a possibility.
Yes.
And then sometimes you become very brave and say, I don't get motion sickness. I'm fine. I don't need anything. But really what you need to do, if you're going deep sea, especially in the Durban area here, you need to take something before you go to stop you from getting nauseous.
All right.
Okay, there are tablets available which you can take a tablet before you go, and there are also patches that you can put behind your ear. It's a little patch that is about a centimeter diameter, and you stick it behind your ear, and that feeds the medicine into your body while you are there, and everybody around you will be vomiting, and you'll be quite
so when
fine.
it's going less way with the waves, the bigger the waves, that's when you would probably feel very uncomfortable. But this is one way of managing it.
Yes.
Now, if you did not do that, and now you're sitting in a situation where somebody, your family member, or just somebody, you want to be a good humanitarian and help someone who's feeling that way, what should you do?
The first thing to do is to lie down. Lie down so that you don't see you see, it's the looking at the horizon and the sea that creates the problem, because your body is telling you that you are on the boat.
Yes.
Your eyes are telling you that you are not straight, that you are this way and you are that way, with the result that there's a confusion in your brain as far as where you are.
Oh, and that
because of that confusion, you start feeling nauseous.
Nauseous.
That's what happens.
So the best is
So
just to lay down.
go somewhere where you can't see the sea, you can't see the ocean,
Yes.
and you're just looking at the boat. You'll be okay. You won't have your hand. So the first thing to do is to get into a situation where you can't see the outside.
Yes.
So there's no confusion between your eyes and your feet.
Yes.
Then the next thing to do is you must hydrate yourself, because people end up in hospital if they vomit too much.
Yes.
They get dehydrated. They end up in hospital.
Yes.
So you need to hydrate yourself. But always a good idea to prevent it rather than treating it.
Most definitely. And then sometimes also when you're traveling on long journeys, and sometimes people feel that uncomfortable feeling also in cars for a long time. They can't travel for a long time. So I'm just guessing, right? I'm going to play nurse here, or a bit of common sense. Stop regularly, stretch your legs, walk out a little bit, especially for the driver. Make sure the driver's not sleepy and tired. Keep hydrated. Do a few stretches. See, doctor, I listen when you speak.
Yes.
But am I correct? I'm going on the right way.
And with motion sickness, it's again the same thing. There's you're sitting in the car and your body is telling you you're sitting down.
Yes.
But in the meantime, your eyes are telling you that you're moving.
Yes.
And the hills and the valleys and
the winding roads.
That creates that imbalance in your mind, which with the result that you start feeling nauseous. Also, the driver is important, because with the driver driving a car where it's not a smooth drive. Some drivers press the accelerator, then they release the accelerator. They press the accelerator and they release. So there's a backward and forward and backward, and everybody in the car is going backwards. Everybody goes, rather than a smooth ride. You'll find that if you have a smooth ride, the chances of motion sickness is minimized. It may be there, but it'll be much less. So it's important how that car is driven.
Dr. Haffejee, before we round up, I have to ask you this question. So lots of people choose air travel, they want to fly, again, whether it's locally abroad, and having little children come with you on a plane can be very challenging, especially when it comes to babies. Sometimes you go, on flights and you hear babies really, really screaming. So what is recommended for the mums and dads that are listening to us today to make sure that this flight is comfortable for this little jet setter? Because the worst feeling would be for this little baby to be really uncomfortable for this child's ears. What's the recommendation?
It's to do with the air pressure. The air pressure on the ground is quite high. The air pressure on the top is low, with the result that when you're flying up, when you're going up, there's no problem.
Yes.
When you're up in the air, there's no problem. But when you're coming down, that's when the air pressure increases outside your body. And of course, your air pressure inside your body is low because you've been high up. So as you come down, the pressure on the atmospheric pressure increases, so it pushes the eardrum in. That's what creates the pain. Okay. So we have a tube called the eustachian tube from middle ear into the nose. That equalizes the pressure. So that tube needs to be open, and if that tube is open, you won't have a problem. But with babies, the tube is very tiny. The 1 millimeter diameter is very, very tiny, and it can block up very easily. So if the child's got a runny nose, before the flight, you must make sure that you give the child a decongestant before you fly. A decongestant nasal spray, not medicine. Don't use medicines. Just a nasal spray. You can buy them over the counter at the chemist. It's a nasal spray. It's a decongestant nasal. Put 1 or 2 drops of sprays into the nose. It'll decongest the nose. So when they're coming down, that eustachian tube would be open. It will equalize the pressure. So and that's what adults need to do as well. If they have got a blocked nose, use that nasal decongestant before you fly. So that you won't have the problem when you come down. And of course, if you are a frequent flyer, learn how to open your eustachian tube. It's quite easy.
I take your advice these days. Makes my life much easier.
Yes.
Definitely. Doctor, I have one very odd question, and then inshallah we will do our closing comment. So on a recent visit to one of these places, very beautiful beach place, but the sand was extremely itchy. So you're coming out of the water, walking in the water, in the beach, and walking on the sand, it was extremely uncomfortable. Myself and my husband, were walking on the sand, and it was our feet started like burning and itching, and it was extremely uncomfortable. So we immediately ran, into the hotel room and tried to wash our feet in cold water. But that pain, that burning, stinging pain, just didn't go away very quickly. And later we were told by somebody that this could be a situation, especially in tropical areas, islands and places where the temperature is very hot. There is something called beach sand lice. Can you tell us, how do you manage the pain and that itch of beach sand lice? What would be the basic first aid?
Yes, it's a problem, especially in tropical islands,
Yes.
tropical beaches. I haven't heard of any cases here in Durban. I
Yes.
don't think it's cold, it's warm enough, it's hot enough here.
Yes.
It's actually bird lice that's in the beach. It's
In the
from
beach
it's from the
sand.
birds. Yeah, it's from the birds that the beach lice gets onto the sand, and of course, as you're walking, it gets onto you.
Yes.
And of course, those are for birds. It's easy for them to get the nutrition from the birds, but they can't get the nutrition from you.
Yes.
So they keep scratching and scratching and scratching and trying to get into you, and that's what creates the problem.
The biting and the burning
Yes.
sensation.
Yeah, and of course, you carry it with you into your room. And if you carry it in your room, and if there are carpets in the room, it's even worse, because now they will breathe more there.
Yes.
And create a big problem for you. So the first aid there would be, you need to cool that area. You need to wash. You need to immediately wash yourself, so that
Cold
you try and get those lice off.
Yes.
And then one of the things you can do is to go and get into a bath. You drown them. You get into a bath.
You immerse yourself in cold water?
Yes. Put your whole leg in cold water, so that they
can't survive the temperature.
They can't survive.
Sure.
So you do that to get rid of them from your body, right? But then one of the things that people need to carry when they are going out to the beach or going out somewhere, even in the Drakensberg, hiking or whatever, they should take a tube of hydrocortisone cream.
Okay.
You can buy it over the counter at the chemist. You shouldn't use it on your face.
Yes.
But it's hydrocortisone.
For any
and
rashes.
that, it helps for these kinds of rashes.
Yes.
It helps for bites, bee stings, mosquito bites. Yes, you can put a little bit on it, and it knocks it out very quickly.
Inshallah, may Allah keep everyone safe during this holiday period. Like I said, when you get to travel, wherever it may be, you learn from this. It could be even in your own backyard or picnics. And, the intention for today's show is to assist parents and even, children that are listening in how they can assist their parents if their parents, have these difficulties. Dr. Farouk Haffejee, an absolute pleasure and honor having you on Phenomenal Woman. May Allah reward you in abundance. And inshallah, we hope to have you back on air with us really, really soon. Jazakallah khairan so much for your time. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. And you're welcome.